Antimicrobial resistance is a public health threat that knows no border. We need to take action, and we need to take action globally and at the European level altogether, because AMR moves from one country to the other, and we are all rings in the same chain. Therefore, we need to address altogether AMR. OECD is an economic organization. We help countries identifying financing gap to tackle AMR, find best practices, and transfer best practices from one country to the other. It's very important when we learn from one European Union member states and transfer what works best to the other European Union member state to tackle effective antimicrobial resistance. At the OECD, we calculate what is the return on investment of scaling up action on AMR. For example, we have supported the quadripartite in understanding what would be the return on investment of a global action plan for antimicrobial resistance, which include infection prevention and control, WASH, stewardship program in One Health perspective. Investing less than 0.5% of what we currently invest on health would help us address all the major policy gaps in the fight against antimicrobial resistance. There is a lot ongoing. European Union member states have been always at the forefront in the fight against antimicrobial resistance, and with the EU-JAMRAI action, I think European Union member states can push further the boundaries of the fight against AMR. There are best practices that are being studied, a lot of discussion on improving surveillance. That's definitely something we need to do. We have information, but not enough, particularly when we go outside the health sector, the human health sector. So I'm thinking about animals sector, livestock, but also even more the environment. And EU-JAMRAI is trying to close this gap at the European Union member states. Plus, we need more action on stewardship and infection prevention and control, both in humans and the livestock sector. And again, this is an area in which JAMRAI plans to move forward.